Hey, I'm Dr. Ruth Roberts, and I'm the creator of the original CrockPET Diet, holistic and integrative veterinarian. So, hope you are having a fantastic day. I've got several questions today about seasonal allergies, and man, is it a great if your pet has allergies, or if you have allergies, regardless of where you live across the country, 'tis the season, literally. So what do you do about that? I mean, the standard answer is we kind of let these guys itch, and then they drive us and themselves bananas enough that we end up, taking them to the vet and then getting some steroids, which are not fun. And pardon me while I try and make this thing behave a little bit better. What do? Steroids are, they're the silver bullet. They're awesome when you need them, but they really have some awful side effects long term. So, a couple of questions that came up. Rebecca had written in about her Bichon that has grass allergies and gosh knows what else, and specifically, so what do you do about that? You can't. Actually, I had a client once upon a time that had her whole backyard replaced with AstroTurf, and that didn't work out so well because it got really hot. The other thing is that yes, maybe there's grass allergies, so yeah, your dog's not walking on grass anymore, but you can't help what's blowing in on the wind into your property. So that's really the thing that we need to work with, is what strategies can I give you to help your pet deal with what's out there in the environment. And then I had another question from Chris. She just moved to Southwest Florida in October from Charleston, my hometown, and hers previously too. And about 2 months into it, her poor pup started itching and breaking out in hives, and thought maybe it was seasonal changes and that kind of stuff. The veterinarian there prescribed steroids a couple of times. Same deal. Poor pup feels better, stops itching, looks better, and then steroids wear off. Whatever it is that's creating the issue is still there in the environment, and what do you do? So so the veterinarian there is thinking, well, maybe it's a food allergy because they're feeding the CrockPET diet. Excuse me, they're not. They're feeding a brand that's mostly turkey. So environmental allergens. Short of putting your dog or your cat in a bubble, there's a couple of things you can do. One is, it's not just what they're walking through, what they're eating, that sort of stuff. It's also what they're licking off their paws, what they're grooming off of themselves. And so for that reason, frequent bathing with a soap-free shampoo, so it's not going to strip the oils and the hair coat off. If you're in the southeast like we are, where fleas are just awful, I'd love to tell you to use an all-natural flea control, and sometimes that's enough, but in many cases, especially in this area, it's not. And so a soap-free shampoo is going to prevent stripping that flea medication off. That way you can bathe your pet on a weekly basis to kind of unload the pollen and antigen burden somewhat. On a regular daily basis, every time they go outside, wipe their feet down with a warm washcloth. There was a guy that made this thing that looked like a giant, those giant coffee mugs you can buy at a gas station that hold like a gallon of coffee, because I don't know who needs that, but anyway. So what he did was put little brushes inside that thing and a little rubber seal on top, and so the idea was you put your pet's paw in there and you've got this little sort of rinsing device that gets all the scrunge off. And so that was a pretty cool idea. You can probably accomplish that with just a warm washcloth. Hey Lisa, good to see you. I think you're on vacation. Thanks for checking in. So that's an idea. Again, the other thing you can do that's very simple. So every time the pet comes in, wipe its little feet off, just to get the scrunge off of their feet. Because what's the first thing they do? They come in, they sit down, and they clean their feet off. The second thing you can do that's really helpful is to take a damp washcloth again and at least once a day wipe down the entire body. And so especially for these low riders like dachshunds or the other toy breeds, probably want to wipe the belly off, the chest and belly off each time they come in as well. The goal here is simply to just pull the pollen and grass and whatever antigens, allergens that are out there in the yard that are bugging your pet off of them. A little bit more difficult to do with kitties, but if you've got a pretty laid-back kind of guy, that it's not too terrible. They'll put up with it. Another thing that is extremely helpful is apple cider vinegar, and it's like that's the new miracle cure for everything, right? Well, and it turns out it really kind of is. So with apple cider vinegar, what we would do is tell you to take about 2 ounces and get a little pint-sized sprayer. Put the vinegar in there, fill the rest up with water, and then spritz your pet with that on a daily basis. Same thing, if they've got a spot that they're working on and chewing on, spritz that area too. If it's raw, it's going to be a little stingy, so be careful there. But the vinegar certainly seems to help reduce itchiness. Also, when you're giving your pet that weekly bath, go ahead and make a quart of that same apple cider vinegar solution up, and once you've rinsed your pet off, used any cream rinse or what have you, pour that on, work it down into the skin, and let that dry on your pet. So towel them off, your regular stuff. The other key there is that if you're bathing frequently, probably not great to use a blow dryer to dry them up for a couple of reasons. One is there's heat in the blow dryer, even if you turn it to the cooler setting. And then the second is that it's drying. And so for a pet that's already got super itchy skin, their defense layer is already down, that's not a great option. So just let them dry off, towel dry, and go from there. So I hope that helps somewhat. That's sort of a baseline treatment. As far as supplements go, this is where gut health really is important. And and I do have a gut health program that talks about rebuilding immune function. We think of gut health only being important if we've got a pet that has vomiting or diarrhea. And the truth is that if 75% of your immune system, you the human and you the dog and you the cat, resides in your gut, if the good guys aren't in charge, that's not going to work out too well. So what happens is when the good guys are in charge, they produce pro-inflammatory molecules. When that happens, you might see diarrhea, you might see vomiting, but you can also see itchy skin, kidney failure, arthritis, cancer. All of those things are based in inflammation. You can see the symptoms for all of those diseases go up. So, the first thing is feed real food, the original CrockPET diet. Feed a fair amount of vegetables. For dogs especially, not so much for cats because they're not as adept at digesting them. And use things like probiotics at a really high dose. If your pet's been sick for a long time or has had allergy symptoms for a long time, I would use it every day for at least a month and then try to titrate the dose down. I've had several clients that that's all the change that they made, plus a couple of other suggestions, which I'll get into in a minute. And the phenomenal thing was it almost completely resolved the allergy symptoms for the pet. So don't discount the gut being your big help as far as controlling the itis symptoms. So dermatitis, arthritis, hepatitis, gastritis, all of those things. Anytime you hear the suffix itis, it means inflammation essentially. So that's extremely important. Fish oil is also very, very important. It helps to control the whole pathway of creating inflammation up at the top level, exactly where a corticosteroid works, but without the side effect. So that's kind of the deal. And steroids, like I said, if your pet is scratching and tearing them up and all of that stuff, and Lisa, I see you're making a comment, live isn't working, and maybe it's just me, and maybe my Wi-Fi signal is not so great. It's been a little dicey out here. So I'm getting some comments. But at any rate, it's just, you got to use steroids sometimes. But when that happens, work with your veterinarian to use the lowest dose possible to get the uncomfortableness under control and get them back off. The other options that are commonly offered on in conventional medicine are things like Apoquil, which is, if that's the only way we're going to get your pet comfortable, I hate using it, but sometimes that's where we have to head. Benadryl, antihistamines, that sort of stuff. The thing that has worked really well for me over the years is a quercetin and stinging nettles combination. And we've used that successfully for many, many pets. I won't tell you it's 100% effective because nothing ever is. But it's a drug-free way to help reduce the circulating levels of histamine, which is what creates the itch in the skin or the inflammation, without any potential side effects. So there's a product on my website called Allergy. Right now it is difficult to get any of these quercetin and nettles products because it's allergy season and they actually work, so they sell out rather quickly. I think that one has just come off of back order, thank goodness, so we should be in good shape. But that's been very effective, very few issues I've ever seen. Occasionally we will see a pet that has some GI distress with it, and oftentimes starting at a lower dose than is recommended and working our way up, we'll get that taken care of for us. So those are sort of panaceas. Coconut oil used topically. So part of the deal is that pollens and allergens sit on top of your pet's skin. By using coconut oil and other sort of cream rinses, things of that nature, you help provide another barrier for getting stuff through. But again, we're beginning to think that a lot of what creates these allergic responses in pets is that they're grooming themselves and they're ingesting the allergens, and that's what's creating part of the allergic reaction to everything out there. So back to Chris's question about moving. Chances are good it's not purely a food allergy. If your pet was perfectly fine, you moved, then really itchy. If it was something that happened rather slowly, maybe. However, having said that, if your pet's eating the same thing day in and day out and it's itchy, you know that there is some gut inflammation already present. And in fact, leaky gut syndrome, which was pretty fringe a few years ago, is now actually mainstream medicine. The other word it gets called is intestinal permeability, and that's exactly what happens. So the little tight junctions in the enterocytes, or cells in the intestine, so they're connected like this. In the intestine, here's the food and stuff coming through the GI tract, here's the little enterocytes, and down here is the immune system. What's supposed to happen is, if everything's working well, that is, here comes the food, it gets absorbed through the enterocyte and then gets broken down inside the cell further, and then these little tiny molecules come down here to the immune system. And what happens is, at that level, these are molecules small enough that the immune system doesn't recognize them as foes. So literally it's 20,000 Daltons or less. And what happens in intestinal permeability is that these tight junctions that normally would prevent cells from, or prevent food from going in between the cells directly to the immune system, open up a little bit. And so now larger molecules go directly to the immune system. And if you're eating turkey every day and your immune system is seeing large enough chunks of turkey to recognize it, you start reacting to it. Sometimes that shows up in the gut, as we discussed. Sometimes it's in the skin. Sometimes it's in the hips. Sometimes it's, it's in the sinuses for us, any number of places. So that's why controlling gut permeability or leaky gut syndrome is so important to controlling allergic disease. And that's why for several clients, just using probiotics was sufficient. Hey Sally, good to see you. Sally did a really good deed and picked up a 12 to 14 week old, I think you said, pit bull puppy that was sort of, yeah, anyway, tragic. So check out Sally on Facebook and she'll get you hooked up with that puppy. Sounds like she's adorable. She's over getting spayed and taken care of today, so hopefully she'll find a good home very, very quickly. So back to the whole gut permeability thing. So if you eat turkey every day, you're going to start reacting to it. And same thing, you know, so to make a long story short, I know all this stuff. A couple of years ago, I was really able to do a lot of bodybuilding and that kind of thing. And, you know, the typical bodybuilding deal is to eat chicken breast and broccoli. Well, guess what? I can't eat broccoli anymore because I ate it every day. Stupid. And Vicky's saying that the live isn't working for her either. I'm seeing your comments, so I'm not sure what the deal is, but the upside is this will be available later. If you post a comment in the section, I'll get it answered for you pretty quickly, so even though we're not able to do it live. So, stupid. I knew better, but, you know, we got into this thing of ease, and, you know, I was working 80 hours a week, and, you know, I just wanted it to be simple. So that's, again, part of why it is so important to rotate what your pet is eating. I'm going to always tell you that home cooked is better than anything else. Some people, it's just not going to work for them. And so, you know, pick good quality brands of food. If you're going to feed a conventional diet, research it well. Go to dogfoodadvisor.com. They've got great research for you. And you know, pick several brands that have hopefully one protein, one carbohydrate source, and rotate brands. Buy small bags. That's another common source of allergies that we overlook. One of the most common sources of allergies now for dogs are grain storage mites, which we used to just worry about in the bags of food because people would go out and buy 40-pound bags of Jim Dandy, and you know, and they'd sit in the heat and these bugs would come in. Your dog eats it, they're allergic to it, sets off the allergic response. So one way to help with that is to buy small bags, throw them in the freezer to kill any of those mites. Unfortunately, they're also ubiquitous in the environment, so it's difficult to get rid of all of them. So rotate food. With the CrockPET diet, it is so much easier. One batch you make with turkey and rice, the next batch you make with pork and sweet potatoes, the next batch you make with beef and quinoa. So that does two things. One is it rotates the diet so your pet's not seeing the same thing every day. And the second thing is that if your pet has a problem with a certain thing, whether it's turkey or the rice or whatever, you know about it, because with that batch, oh gosh, they're kind of itchy. And then the next batch, wow, they're a lot better. And then you feed that protein again, and in 2 days they start itching. Then you know that's a problem. So what do? Pull that out of rotation, pick something else, go forward with that. So I hope that makes a little bit sense. That's kind of with the gut health program. That's a very uncomplicated way to do a rotation and elimination diet. I go through completely how to do that, and really you're making food, you know, 3 batches of food and rotating every 24 hours. Again, the goal there is to reduce the inflammation in the GI tract and stop presenting your pet's immune system antigens for day after day after day. So that's really super important. So back to Chris's question, you moved, pet got itchy about 2 months and later, and then you know you're in the steroid hurdle. And I have to say that is very common for environmental allergens. People move to Charleston from Ohio, and somewhere between 2 weeks and 2 months, that dog or that cat starts scratching like mad. And so then, what do you do from there? So I've already gone through several things you can try. The other thing that has been extremely helpful in practice is HESCA has an allergy test that's a blood test. So none of this is a cheap solution, but it can be an excellent long-term solution and actually save you a lot of money at the end of the day. So it's a blood test. It's 95% comparable to an intradermal skin test that a veterinary dermatologist would do. And then the other thing that I'm really liking with HESCA is that they have an oral version of a hypo-sensitization therapy. So instead of allergy injections that are, you would have to do, daily to a couple of times a week, you're doing 2 little pumps in your pet's mouth twice a day. And we've seen that be effective. Their statistics, HESCA statistics, are about 65% of the time. I feel like it's a little bit higher, like maybe 70 to 75%. But for many pets, that has been fantastic because they don't get that major increase in itchiness when their allergy season comes. They don't have the severity of the symptoms they had as far as so itchy they're just tearing themselves to shreds. And we can use much, much, much lower guns, and often just bathing, apple cider vinegar rinses, and quercetin and nettles to help control the symptoms they do experience. So that's been a great option. Talk with your veterinarian about that if they've not talked with you about it. Not cheap. I think, at the end of the day, between the testing and then the first 4 or 5 months of immune therapy, you're going to be somewhere around $400 or $500. But that beats the heck out of steroids, increase in symptoms, more steroids, increase in symptoms. So you're not thrashing your pet's immune system. You're using that immunotherapy to help teach it to not respond as intensely to those particular antigens. The other upside too is that if your pet has mold sensitivities, that can be used in the oral formula but not in the injectable, because you get huge reactions with injectable mold pollens. So that I would talk with your vet, Chris, and I think that it still makes sense to rotate food. Check it out. It may be that the turkey maybe is not directly allergic to it, but is sensitive to it. And so by pulling that out of your dog's diet, that helps to drop the symptoms down quite a bit. The way I used to talk to clients about it is, if you'll pardon the bad graphics. So if this is, time, and this is stuff it takes to make your pet itch, so, if this is the bar of stuff that your pet has to get over to start itching, and it's got a food sensitivity, that food sensitivity is jacking your baseline bar up from the bottom, so that once you add pine pollen on top of that, it takes much less to get over that itch threshold, if you will. So taking away the things that are simple, flea allergies, food allergies, drops the itch threshold down for your individual pet and helps control symptoms a bit more. So in the Southeast in particular, I can't tell you enough. Unfortunately, for many of us, we do have to use some sort of a topical pest control, whether that's Advantage or Seresto collars or whatever that seems to work. That's the way I would go. A lot of people prefer to go with the oral tablets, like NexGard and Brevecto and things of that nature. And I have to say, it just really creeps me out that we're giving an oral pesticide that we know is going to stay in the pet's body for 30 days, or in Brevecto's case, 90 days, and not expect that there's going to be a problem later. Their safety reports and adverse event reports are extremely low, which is awesome. But the thing that we are not able to measure currently, and frankly we can't with the topical flea controls either, is today is okay, but what happens after 4 years of that? Is that part of what's contributing to the increases in cancer we're seeing, and inflammatory bowel disease and all the other yucky stuff that we as humans are dealing with as we age? I don't know, and that's the question mark. So next month we're going to be presenting you some blogs on things you can do to help control fleas in the environment and on your pet that are not pesticide based, and those are important. So watch for that stuff coming up. So those are important thoughts, and that's really where I would start. Chris also asked about allergic reactions to coconut oil, and I can't tell you I've seen that, but if it's something that they're eating every day, it's very possible. The one thing I have seen with coconut oil is that for dogs, and I've not seen it in cats, so that's why I'm saying dogs, that are sensitive, that have had pancreatitis, or maybe breed-specific prone to pancreatitis, like schnauzers, dachshunds, things of that nature. There may be, we've seen some of these guys as the coconut oil dose ramped up because folks are trying to use it to help with allergy symptoms typically. We have seen some dogs develop pancreatitis. So topically it should be okay. However, if you put that on your dog and it's like, whoa, that's a problem. So you can't use coconut oil, but apple cider vinegar probably good. So as far as other oils you can use in the CrockPET diet, you can use grapeseed oil, you can use avocado oil. There's something out there on the net about avocados being toxic, and no, not really. Your dog would have to eat like a truckload of avocados to have any issues, so not a problem there. Olive oil, I would avoid canola oil just because of the way it's processed. But when you use those other three oils I just mentioned, wait until the food cools. And really we should do this with coconut oil as well, because heat destroys the good components of the oil and makes them less beneficial to your pet. They still get the calorie nutrients out of it, but the anti-inflammatory properties are lost to some degree. So Chris, that's the deal I've seen with coconut oil. But look at your pet and see what they are telling you when they have issues. So that's what I know so far. Hopefully this is working for you guys a little bit better. Sally said that her puppy is being spayed now and she'll be ready for adoption really soon. So if you guys have got other questions, let me know. I think there was one other thing I was going to let you know about. Jenna, the lady that does our customer service, texted me last night, kind of freaked out because her dog Simba, who is very, very picky about what he eats, had counter-surfed and eaten an entire 90-gram bottle of holistic total body support. So Simba has lived to tell another tale, but that tells you how tasty that stuff is. So cruise over to the website, check that out. We still have a buy one get one free, and that'll be on till the end of May. So that's what I have for you guys this week. Keep the questions coming. We've got, message me on Facebook. On the website, there's a box on the sidebar that says Ask the Vet. You can drop in your email and send a question over that way. That's where Chris's questions came from. Comments under this video, I'll have each week's video pinned to the top of the page. And that's what I got. So you guys have a great rest of your week. And remember, your pet's best health starts in the bowl.